You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic, Dr. Jeffrey Fox. Dr. Fox, welcome to the program.
Thank you. How are you today?
Good, good, good. Now, I know you brought a lot of photos. We'll try to get to as many of those as possible.
Sure.
So with dental implants, like who's the typical patient that's a candidate or comes in for dental implants?
Randy, the typical dental patient, it falls into two categories. First category is the ones who are losing their teeth and need a lot of dental work. And the second category is patients that are already wearing dentures, which are a pretty difficult segment to get a hold of.
What, the denture wearers?
The denture wearers.
Why
yes.
is that?
The denture wearers are out of the loop. They're not part of my practice. They're not part of anybody's practice. They're just existing in their own world. And
once they get their dentures, they don't go back.
They don't go back. They have plastic things and they somehow have gotten accustomed to them, and so they don't come back anymore.
Now, at the top of the show, we said nobody, I paraphrased you slightly, but you believe nobody should be wearing a traditional denture. Is that right?
It doesn't make any sense. It's as if somebody thought it was okay to have if they were missing an arm, to wear a hook. Okay. I mean, they would make a prosthetic hand. Mm-hmm. And denture is just a terrible prosthesis. So I don't understand in this day and age why anybody would wear a denture. Okay,
now you made dentures in the old days?
I certainly did.
But you don't do them anymore?
I don't do dentures anymore, no.
So what, the future of dentures will just be, they'll all be attached to something?
It
attached
is.
To implants?
The future is now.
Okay.
Why it's not being done regularly is simply just a matter of convenience.
Okay, good. Now in your practice, I mean, somebody literally can go in with no teeth and walk out in one afternoon, one day.
Correct.
With a full brand new set of teeth, upper and lower.
Correct.
Is that right?
Always. We strive, and our practices are perfected in it, in making, not only putting the implants in the same day, but putting in at least a temporary set of teeth the same day, and sometimes a final set of teeth in the same day.
Now, are there a lot of denture wearers? You know, at the top of the show we said no more dentures, but are there a lot of denture wearers where you are?
It's ridiculous. You could fill up Yankee Stadium and Citi Field, where I'm in New York, with the denture wearers, and 3 times over.
Is that right?
It's just millions and millions of people that do not have teeth. They're called edentulous.
So then if getting your teeth back with dental implants is so good, why aren't all the denture wearers doing it? Or the people that are headed to dentures, why aren't they doing it?
More of the people that are heading to dentures do it because they're afraid that they're going to have teeth in a glass. Okay. But the people that have teeth in a glass at night, they're out of the loop. They don't even know that this procedure exists. They don't know. They've been told by their last dentist, who's uneducated in advanced techniques, they don't have enough bone. So if they don't have enough bone, then what are they going to go get an implant for? Those commercials are not for them.
Okay.
And that's just not the case. We can grow bone anywhere. I don't have a patient that comes in that we can't do an implant case on. There's always something that we can do. So they're not wearing them. So
denture wearers don't go to the dentist?
They don't go to the dentist ever.
So they don't know their options, possibly?
No. They go to the dentist when their dentures break. They go to the dentist because their denture's really, really loose and they can't, and a whole tube of case doesn't hold them in place anymore. That's when they go to the dentist. Or they go to the dentist when their insurance plan pays for a new set of dentures and they think that maybe it's cool to get a new set of dentures. That's it. So you see those patients once every 10 years.
So it's hard to get the denture wearers in?
It's hard to get them in there, sure.
If they knew how good it was?
They would never.
They would all do it?
Of course they would.
Not enough dentists in New York to take care of them?
There isn't enough dentists in this country to take care of all the denture wearers. Just not. And the real reason why denture patients don't come in is think about that denture patient and how they became a denture patient. Because unfortunately, both my parents are denture wearing patients.
Is that right?
So they got there because they went to the dentist, they had cavities. Then they went to the dentist a year later and they had more cavities. Then they went to the dentist a couple years later and they needed a root canal. And they had pain and they needed their tooth out. And then another tooth came out. And it was costly. And every time they went back, it was another problem. And then it was another problem. And then finally they got so disgusted with the whole idea of going to the dentist and hearing a bad report. They get nervous sitting in the chair waiting for the doctor to give them the prognosis of these x-rays. They're intimidated, they're anxious. Here it is, another long list of things to do, that they said, the hell with it. I'm done. Can we just take them out and put dentures in? And believe it or not, crazy as it sounds, those patients are happy. Even though the dentures are horrible, even though
Because what? The pain's over?
the
cost is over?
the pain's over. So they deal with a couple weeks, a month of getting used to these plastic things in their mouth. They get used to the fact that they're not going to taste food anymore. They're going to get used to the fact that they're not going to be able to chew their food anymore. But you know what? They got rid of all the aggravation and pain and suffering and whatever else they felt and cost of fixing their teeth. So that's the compromise they made. What they don't realize is that it was a horrible compromise. It was a horrible choice. But for them, at that moment in their lives, it was the correct choice. What I'm trying to say now is that we can correct that. We can get to that and fix that and give you permanent teeth again. And to me, not having permanent teeth is a travesty.
So how old can you be to get dental implants?
Just yesterday, or 2 days ago, I treated a patient in my office in Manorville, and she came in, she was 94 years old. So she said to me, I said, you're gonna lose the rest of your lower teeth. That's the bad news. And she looked at me and said, I'm 94. I said, yeah, I said, I'm gonna have to make you a denture unless I put in implants, which is really what we should do. So she looked at me and she said, I'm 94 years old. I said,
Yeah, why would a 94-year-old want to do this?
I said, okay. I said, how long do you plan on living? She said, I plan on living to 100. And I said, you're gonna live to 100. So why would you want to spend the next 6 years of your life not chewing your food? Why would you want the next 6 years of your life putting teeth in a glass when we can do something for you immediately? This doesn't have to be.
Like a brand new set of teeth.
Brand new set of teeth. We're going to give you back what you haven't had in 20 years. You were just working with the 6 front teeth. You're going to have a brand set of teeth. You're going to enjoy the last 6 of your years of your life, if that's all it's going to be.
So what'd she say?
She was like, I don't know. I don't know if I want to. And her daughter was there.
Okay.
And her daughter looked at me and she smiled and she said, Ma, why wouldn't you want to put your teeth back? I said, maybe she's trying to save that money for you. I don't know. But it's such, if this was my grandmother, if this was my mother, I should say, I'm getting older, there's no way I'd let her walk out of here with a denture. It's barbaric. So why wouldn't I want to make her happy the rest of her life? It's not going to be any more complicated than taking her teeth out. While I take her teeth out, I can put the implants in immediately. She's done.
So what'd you do for her then?
Well, she came back, decided that she was going to put implants in, and one afternoon, we took out her teeth, put the implants in, and she went home with a screwed-in set of teeth.
Brand new set of teeth.
It took about an hour and a half. Correct.
So you do
done.
it very quickly. Is that, I mean, what, in fact, you told me in the green room, what you do in about 45 minutes, most guys takes about 3.5 hours.
Correct.
Is that right?
Yeah. I've done so many of them that it's second nature to me. So
Now, there's a video of you that I saw, and you've done more than 30,000 of these implants. Your teeth, could you smile for the camera real fast? If we could take a look at that. Okay, you were going to lose your 2 front teeth.
Correct.
Is that right?
That's it.
And on the video, you pulled out your teeth and put in implants yourself.
correct.
Is that right?
Yeah. I wouldn't advise that for most people.
In the video, you say no animals were hurt in this
No,
video,
they weren't.
but you did it by yourself.
I did it. Yeah.
I mean, has that ever been done that you know of? A dentist putting in their own 2 implants and...
I saw something similar, but nothing quite as aggressive as I took it there. But
Is that right?
it was fun. I had spectators and oohs and ahs. And
Well, good. So what'd you bring? You brought some photos. What are we looking at?
typical patients that have come in, teeth a mess. And these are all cases that were done in less than a day.
Okay.
Here's a lady, big smoker. So she comes in and her teeth are a mess. And even though her teeth are a mess, she doesn't want dentures. Her mother had dentures that she put in a glass. She never used them. As a lot of denture wearers, they don't even wear their teeth when they chew. They take them out if they're private.
Right? Okay.
She didn't want to be that way. So if she had to have ugly teeth that worked, that was good by her. So dentures were out of the question. So with her, we did exactly what she came in for, which is take out the teeth and put in a brand new set of teeth that day.
Is that right?
Yeah.
And now, how soon can they eat?
They can eat immediately, and I have them eat a softer diet. I have them eat something on the consistency of hamburger, and within 3 months they can chew anything at all. Nuts,
Like hard
peanuts,
things? Really?
candy, doesn't matter. An implant is actually stronger than the tooth was. So if we put the implants in properly and make a great prosthetic, they could chew anything they want, anything.
Now, what do they like more? What they can eat or the way it looks?
You know, it's funny. The patients that come in and hate the way their teeth look. They just want cosmetics. So, and I always try to give the patient what they want. In the back of my head, I'm thinking, I need to make this patient happy and functional, but I don't even talk to them about that. I'm going to make them look great.
Functional meaning the eating
Functional,
part.
so they can eat properly again.
Okay.
That's kind of my job.
Right.
I mean, part of the second part of my job is making sure they look good, but the first part of my job, at least my training, was to make sure that they could function properly. So a patient comes in and they want a smile makeover, they call it.
All right.
And they hate their teeth, and their teeth are bad, and they need to come out. So we're going to take the teeth out and put these beautiful teeth in, which we do. And they come back, and instead of telling me how beautiful they were, they tell me, oh my God, I can't believe I haven't tasted anything in the last 15 years of my life. I can't believe what I've been missing. So that patient who came in because they didn't like the way their teeth looked are now thrilled that a whole different part of their life opened up for them. It's amazing. Then I have the ones that come in, and usually they're guys, and they just hate the fact that they can't eat steak anymore, and they can't have pizza anymore, and they can't go out with their friends, and after they play golf. And
most guys wait until they're in so much pain they can't take it anymore?
Guys are incredible. Guys
put it off, right?
They just put it off and put it off and put it off. And they just want something that works. They don't care what it looks like. I'll show them a mirror. I go to show them what it looks like. They don't care. Whatever. Just doc, just make it work, please. And I'll do that for them. They come in a month or two later. They're dressed differently. They're coiffed differently. They're out on dates. I mean, it's so they come in for one thing, but they leave with both things.
They like the appearance part.
They love the appearance. Who doesn't want to have a great smile? I mean, you are used to not having a great smile. So you don't think about it anymore. But who doesn't want one?
Well, you're a dentist, so it does not surprise me to hear that you probably think that the teeth are the most important thing, or one of the most important things.
So you think that it's on me. You think that I think that, but yet all of society feels that way. What is number one or number two on the list of most attractive things that you look for in a person?
Point, smile.
It's a smile. When you look at a Hollywood person, the same actor that plays in one series is missing a tooth. In the next series, he's a drug addict and missing a tooth. In the next series, he's the mayor and his teeth are perfect. When you look at somebody and their teeth are in bad shape, you think that they're slovenly. You think that's their attitude.
That's a good point. Like in the movies, when they want to make somebody poor,
absolutely.
you give them bad teeth.
Absolutely. And honestly, I mean, I always say that the eyes are the windows to the soul, but the smile is the window to the heart. A smile makes you warm. It just does. And if that's just not me saying that. Hollywood says that. TV ads say that. Everybody says that.
Now we should mention, because dental implants are getting brand new set of teeth. This is not covered by dental insurance. Even if you have the best dental insurance, covers a small part. Medicare, Medicaid doesn't cover this either.
No, but the reality is that we have all sorts of financing and all sorts of plans that 95% of patients can qualify for, bringing the cost of any of these treatments down to several $100s a month, not huge numbers. Patients complain.
So people are financing this?
Of course.
Like every day?
Or every day. It goes on. Most patients finance. Most patients don't have thousands of dollars in their pocket, but most patients can afford a couple $100 a month payment.
To get a brand new set of teeth.
And get a brand new set of teeth. Patients complain to me all the time. They say, I don't have dental insurance. If I had dental insurance, I would get this done.
Yeah, that's a good point.
Right. So I said, okay, if I could get you dental insurance and it was $250 a month and could get all your teeth fixed, would you do that? And they say, yeah, I would do that. Well, you got it. That's it. And it's not even dental insurance forever. It's dental insurance for a few years to cover your cost of payments. It gets done.
So there's no more excuses.
That's not the excuse.
But what about pain? It seems very painful.
It's just not something that comes up very often in conversation.
I mean, they're worried about it though going into it.
They're worried about it going in there, so we give them a pill to relax them. Most of them don't even realize the procedure was done. They wake up, they take a couple Advil afterward. It's just not a consistent complaint, and nobody cares. Most patients can go to work the next day.
Is that right?
Yeah. So
and you can eat whatever you want. So you can eat like chewy things, like when it's all healed up. I mean, you could eat like pizza or steak or chewy stuff.
Sure. That's what the whole thing's about. You're supposed to have your total bite back. You're supposed to enjoy life. Part of enjoying life is enjoying what you eat.
Okay. Now you have more photos. Let's take a look.
That particular woman almost became a shut-in. She wouldn't go out of the house. Nobody could help her, apparently. And she saw my commercial. She came in with her husband.
What did she say?
She said, my teeth are awful. She was slobbing. She was hunched up in the chair. She didn't want to talk to me. She was covering her mouth.
So those are her teeth in this photo.
Those are her
but
teeth.
You can't save them.
You can't save them.
Okay.
So, discussed the process. She thought that it was too good to be true, that it's not possible, but she went along with what I was telling her. She believed in me. This woman comes in one afternoon. We give her that beautiful smile.
Nice.
She gets up out of her chair and she starts kissing me and hugging me and thanking me, crying.
Nice.
She goes into the waiting room, brings her husband in. He looks at her. He can't believe what he sees. Very, very touching. I don't like to say that I change lives, but in this particular case, I know that I changed a lot.
So their lives are changed.
Absolutely.
Do they ever say that?
They say that all the time.
Really? Like they say
that
this
all the
has
time.
changed my life, or you've changed my life.
I say that all the time, and it's like I don't have a God complex, but I do feel that I'm changing people's lives with this stuff.
Is this, it's like the third set of teeth. You got your baby teeth, adult teeth, maybe they fall out. You get now your third set of teeth.
Yes. You get another chance.
And these are like permanent. I mean, they could last as long as you take care of them or brush them like regular teeth. You're good.
The titanium doesn't decay. It's not organic. So a titanium implant in the bone, with any kind of care, will last them the rest of their life.
Okay.
The teeth that are put on top of them are usually made out of zirconia. Zirconia doesn't decay, and it doesn't stain, and they don't wear. So really, we have cases that are out there for 15, 20 years that look like the day we put them in. On the before and after on this patient, if you notice that her teeth here, they flow with her lower lip. They're rounded. This patient is still conscious of smiling. That's why she's not showing all of her tooth. And she will. So it's a very, very natural look, and we could make it as beautiful or unnatural as you'd like.
So do they know what their teeth are going to look like when it's done? I mean, do you kind of give them an idea?
Absolutely. We have a computer imaging system, and we have the patients pick out what smile design, because there's different smiles.
Is that right? They say, I want that smile.
Absolutely. So we can design it any way they like. Unlike their own teeth, when you're trying to design things on their own teeth, we're limited by where those teeth are. Here, we're not limited. So we can put those teeth in any position and in any shape that we want.
Okay, good. We're going to take a quick break. We come back, more of the photos and more about the process, what people can expect on day one. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
The aesthetics of my teeth were never 100%. I was a very difficult case. I'd consulted several dentists, and they were intimidated. They weren't certain that they could do it for me, and I have been extremely happy with the result.
With Forever Smile, we can place as little as 4 implants, and by the afternoon, they're walking out with a brand new smile.
Could be out in public the same day. It's a wonderful innovation. I would recommend it to everyone.
Call Pure Dental for a complimentary consultation today.
The new partial for my missing teeth is amazing. No one even know that I have it.
Cut.
The new partial for my missing teeth is amazing. The new partial.
Forget dentures. Replace missing teeth permanently in one day, starting at only $39 a month. Pure Dental, a state-of-the-art dental spa, minutes off of the LIE at exit 70.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to Dr. Fox, he says nobody should be wearing a loose-fitting denture. Welcome back.
Thank you.
So the process can be very quickly. I mean, if they come in, you meet with them,
Right.
get some imaging. On a second appointment, they could actually, theoretically, I mean, if everything works out right, they get teeth a second.
That's the typical
appointment.
That's a typical appointment. They come in to see me for a consultation. We have our CAT scan there. Everything else is there. So I take the images to make sure that there's nothing that dentally they're sound. I make impressions, go through the process, and they make an appointment. The next visit, they're done.
Now, take us through the process. If somebody goes in, one of the two categories you talked about, a group of people with really bad teeth can't save their teeth, right? And they know one thing, they don't want dentures. And the denture crowd, when they go to you, what are their options for dental implants?
The ones that are going to lose their teeth and don't want to wear dentures, those are the cases. Those are the patients that immediately I'm going to put implants in and permanent teeth.
Okay.
They don't want to talk about dentures, and I don't want to talk about dentures. They're 100% right. So that we offer them one thing, because they're coming there for that. They don't want to have anything that goes in a glass. The denture wearers, on the other hand, they're already used to having things in the glass. They just want things that maybe can work better.
Okay.
So we have a second option for them when they don't want to go for permanent teeth, and that is to put implants in that hold their dentures in
Like
place.
lock in their mouth.
It locks
Okay.
the denture down. So they're still wearing a denture, but the denture isn't moving. They don't need dental adhesive, and it works a lot better.
They could eat with that, like
They could eat-
salads, things like
Yeah,
that.
they could eat better, 50% better than they could eat before. But still, I don't like doing those cases in general.
The snap in, snap out
The snap
teeth.
in, snap
Okay.
out, because nothing is like having your own teeth, period.
That don't come out.
Don't come out. Why would you want anything that comes out? Why would you want something that's covering your mouth and affecting the way you chew and eat? And
I have to ask you, what about the people with bad gums? Can you have your gums be too bad to get this done? Like infected?
Actually, that's the best patient, because they have gum disease, which is unhealthy and it's bad for their heart. So when I take out their teeth, their gum disease is gone.
Oh, really? Okay.
So I've just resolved their gingivitis or periodontitis problem,
Okay.
and given them permanent teeth that are on healthy gums.
One other question. What about the denture wear? They've been wearing dentures 20 years. Isn't it true you don't have enough bone after 20 years of wearing a denture to do this?
It used to be true, and maybe in some offices it's true, but there's always bone in areas to anchor implants. There's a whole process of...
So you don't have to turn people away because they don't have enough bone?
No, I don't know the last person I've turned away. It might be a medical reason, and I'm worried about their medical history,
Okay.
but not their dental history. This is a patient who came from another country, total mess, and they have arranged marriages. So the mother brought the son in and talked about, we need to get him, he's supposed to meet his fiance, and we need to do something quickly. Is there anything other than dentures? And
Couldn't save those teeth at all.
couldn't save those teeth. Not in
That's got to be unusual, seeing teeth this bad.
It's not that unusual. It's not that. You don't see them. You see them on my pictures, but you don't see them because people hide their teeth. If you had teeth like that, would you
That's
be
a good
smiling?
point. So they don't smile.
They don't smile. They got used to that. They're reclusive. They're not part of society.
So what'd you do for him?
So we did the same thing. We took out his teeth and gave him brand new teeth in a day.
Looks very nice.
Yeah. Here's another guy, actually a really good-looking guy, 32 years old, and just a disaster. And he could not and would not go out on dates. He wanted to go on Match. He wanted to meet people. And here he is, bright, good-looking guy, and he didn't want to meet
How old
girls.
is he?
32 years old.
Okay. Too young to be wearing dentures.
Too young to be wearing dentures. Everybody's too young to be wearing dentures.
Okay.
Everybody's too
Okay,
young. It's
okay.
just, let's get dentures out of the vocabulary, please.
All right,
It's just,
all right.
It's just not a good thing, especially when we can do something so nice. And he was the same thing. We did we took out his teeth, gave him a brand new smile, and now he met the woman of his dreams, and he's extremely happy. Always stops in every couple of months, even though he doesn't have an appointment. Says hello, thank you. Just wanted to say hi, doc, and
So this is like a big boost to the self-esteem
huge,
and charisma. I mean, that's attractive.
huge.
So when these people get that back, you say they dress differently. They're like back in the gym. It's like, when people get their hair back, when I see those commercials, the guys are running and hiking and canoeing. And it's the same. Is it like that?
It's exactly the same. They get their swing back. They get their groove back. Their mojo. I mean, they get it back.
Yeah, now, we're going to take another quick break. We come back, more about the first step. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I love my new dentures. You can't even tell that I have missing teeth. Cut. I love my new dentures. You can't even tell. I love my new dentures. What? No.
Forget dentures. Replace missing teeth permanently in one day, starting at only $39 a month. Pure Dental, a state-of-the-art dental spa, minutes off of the LIE at exit 70.
Anybody have any glue?
And we're back. It's the dental dating game brought to you by Pure Dental. Okay, Shayna, who's the lucky guy? 4-time Nobel Prize winner Sir Paul Mason?
No, ew, gross.
Next
no.
up
Oh my
is
God,
8-time
no.
Grammy Award-winning rapper Bling.
God, no.
Not today, Bling. And here's Steve, junior accountant from a mid-level firm in New Jersey.
Yes, him. I choose him.
You saw it here, folks. Perfect teeth from Pure Dental can change your life. Get a brand new smile for less than $100 per month.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, no more dentures. Dr. Fox, welcome back to the program. We have like a minute and a half left, but your parents, if you could shorten up that story because we have about a minute left, but you said you couldn't help them. Like they were wearing dentures, and when you first started, you didn't know how to do dental implants. Tell me about that.
My parents, not wealthy people, growing up in Brooklyn, when they went to the dentist, it was an extraction. And finally, it got to the point, by the time my mother was 25 years old, she didn't have any teeth left. By the time my father was 35 years old, they didn't have any teeth left.
Now, you were already a dentist at this time?
No, I wasn't a dentist. No,
Okay.
I was a little one then.
All right.
When I graduated dental school in 1984, I didn't know how to do dental implants. So it wasn't until 2000, 16 years later, that I finally looked in their mouths and could not believe what I saw. I didn't know they were denture wearers.
Is that right?
My mother swears my father didn't know that she wore dentures, which that's hard to believe, but they are the typical patient that gets lost in the shuffle. And they suffered. They managed because human beings adapt to a lot of stuff, but it was awful. So as soon as I learned that, and as soon as I was capable to place implants, I put in implants and gave them teeth.
So they both have teeth now?
They both have teeth now.
Is that right? And when it's all done, is this one of those things where people say, I should have done this a long time ago?
Everybody says that. It's the same thing as when I needed a knee replacement and I didn't want to do it. And I walked around and I adapted to it and I got around and whatever. And then I finally did the knee replacement. And yeah, I had to rehab it. But 6 months later, I said to myself, how did I walk around like that my whole life? And it's the same thing with a denture patient. I think it's even more so because it affects every part of your life. Your social, your ability to chew, your esteem. So everybody feels the same way.
Good. And you have financing. So
And we have
insurance doesn't
financing.
cover this, Medicare doesn't cover this. You have to have decent credit to get this done?
Reasonable.
To get it financed?
Yeah, you have to pay your bills.
Okay. You say about 95% of the people are financing it. Is that right?
That's right. Well, we have relationships developed with several different banks as well as lending institutions, and we worked out arrangements with them so that 95% of the patients end up with financing.
Is that right? Okay, so no more dentures.
No more dentures.
If you don't like your teeth, do something about it.
Absolutely.
And you put in your own implants on your front two teeth.
I did.
Is that video on your website?
Yes, it is.
Is that right? We got to take a look at that.
Okay.
That is a hilarious video. I want to thank you for coming to the show.
Thank you.
So 30,000 implants you've done, more than that.
I think so.
And you say that every year your costs are coming down.
Correct.
On these implants.
Correct.
You're an efficiency expert.
Absolutely. Yep.
Is that right? And it doesn't cost more to go to a guy like you.
It costs less.
Is that right?
It does.
I want to thank you for coming on the show.
Thank you.
Good work. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.